You just completed your detailed perio assessment, shared your diagnosis with your patient, and informed them they need non-surgical periodontal therapy. And your patient's response to this information is, well, no. They don't want to do it, or they just flat out can't afford it. On this episode of RDH Coast to Coast, Tina and Kim discuss this always challenging situation. How do you handle when your patient does not or cannot follow through with the treatment recommendations you've made? Friends, grab your headphones, listen in, and share it with your dental team to hear insights about when it's more than a prophy.
The topic that I wanted to try to, venture into a little bit can be a little tricky, but this was brought up by a listener about how do you deal with the patient that is the patient that's always in your schedule for a prophy, but they need scaling and root planing, or they need periodontal therapy. And we can definitely get into the nitty-gritties on it, because I think there's so many different, it's not a one size fits all, it's not a cut and dry. And I think it all kind of stems to is what's the protocol of the office, or what is the doctor saying? Do you dismiss the patient? Do you see the patient? There's so many different
there's so
areas.
many things.
Yes.
Yeah.
So what's your take on any of that, or where would you like to start?
Yeah, when I think it is, this topic can relate to practically any treatment within dentistry, right? It's not just the patient that needs periotherapy and is declining to do it. But honestly, I would say it comes down to when you have a patient and say they do need periotherapy, and they're like, all I want is the basic cleaning. That's all I want. Is really educating them and providing them with all of the details, and looking to see, saying like, this is where your inflammation is. This is where your bone level is. This is the kind of calculus. This is the bacteria. Like, provide all of that information so that they can be informed and still understand what their risks are. And you do that, go ahead and do the best that you can with the time that you have to provide that prophy or the scaling when the presence of inflammation, and let them know that it could make the situation worse, right? And then when they come back, this is what I've done. I'll just say this is what I've done. And when they come back and I say, okay, you've had some time to think about this, to consider it, what would you like to do? And if they say that they don't want to continue forward, that's where I think you as a clinician kind of have to go, okay, what can sit in my good conscience? And there's times where I've told my patients, like, especially if they have pretty significant perio, I was like, in my good conscience, I cannot continue to provide substandard care for you, where it is just going to continue to cause problems or not benefit you at all. Really, what I'm doing is providing you with no benefit. So there's no point in you being here spending this money if you're not going to treat it.
Right.
Because and I think it's not beneficial.
Yeah. Right. And I think in my experience, what we have done too is if it gets to that point and they're not doing the treatment, then we refer them to a periodontist and say, this is where you're going to need to go for your care. We are no longer able to treat you. Your disease is, progressed too much. I've also seen it though in a patient, they can't afford it. They don't have insurance. They can't afford it. And it's not like they don't want to do it. They can't do a payment plan. They can't do it. It's those patients that I struggle with, well, we're not going to see you anymore. And I related back, I had a family member that, this is totally off topic, but needed a hysterectomy and wouldn't do it. They were getting bladder infections over and over and over again. It was compromising their health. They didn't want to do it. They didn't want to do it. They didn't want to do it. Eventually they would do it, but their doctors still saw them in between. Like, their doctor didn't say, I can't see you anymore because you're not having this surgery. So it's not a I feel like the same with, your gum health. It's not a one size fits all. It's not a cut and dry. It really comes down to education, building that rapport with that patient, having them trust you, really, not judging them or shaming them, I told you that this is it and whatnot, but getting down on their level, like, tell me what you are understanding, or tell me what I can clarify more for you, as opposed to just walk out the door, we're not seeing you ever again.
Right. And I know, and I think sometimes we as clinicians are so concerned about what will insurance cover.
Yes.
Or what will happen if I don't do this, that we allow that to kind of dictate our actions. And that's in every aspect of healthcare. Unfortunately, here, the way that our healthcare system is right now, whether it's dental, vision, general health, but the topic, when you talked about like when they can't afford it, that in dentistry, it is so very different because societally, dental is very separate from medical, right? And
because the mouth is attached to the rest of our body, but
what?
we don't have toe insurance, right? I don't have insurance for toes, but I need insurance for my mouth.
Yeah, right. Exactly. It's kind of like what I don't understand how that happened.
Well, exactly.
Right. And it is, that's the big struggle, for sure. And then it's kind of like, well, maybe does the office have a policy set up where they truly have like time, resources set aside for individuals who are in desperate need for those types of services, that they can say, okay, well, we can have X number of patients, X percentage of patients that really who are financially unprepared or unable to take care of this, that we can provide some services for.
Right.
And in regards to doing that, kind of like taking the social healthcare benefit in-house and saying, okay, we're going to donate X number of services per year. I think that could be an option for an office, or even for the states where hygienists can be independent practitioners. Right. That could be something that they can be kind of worked into the business model of X number of patients or percentage of patients per year could do that. And then if you've reached it, then you could say, okay, next year.
Yes.
Yeah. I'll put you on the waiting list for next year.
I absolutely agree with that. That's so important, I think, because even I can say on the side, have I, seen the little old man who has a few 4mm, 5mm pockets that needed to be scaled and root planed, but he lives on a fixed income. And then did I do it in the chair? Absolutely.
Absolutely. Did. Right. You're like, sorry, we got visiting. I went 15 minutes longer.
Exactly.
Yeah. I think we'd be hard pressed to find any hygienist who hasn't done that.
Right.
Who hasn't been like, oh, okay, you've got this, localized perio infection. We're going to deal with it right there. Yeah.
Glad we're on that.
Yeah. It's hard pressed to not find that, it is, because especially when you're just right there and you're like, okay, yep. Okay. Or the patient, have you done this before, where the patient who was like, I know I have perio right there. I don't want you going subgingival right there. I don't want it. You're like, okay.
Yeah. Sure. Yeah. No, I get a lot of, there's a crown, just so you know, on 29. Don't touch. It's a crown. Okay. Got it.
Got it. I didn't touch it with my finger, but I touched it with the instrument. So when you say don't touch, what do you really mean?
Just with this topic, or any really aspects of that, there's not a one size fits all, and I don't think it's a cut and dry, send them on their way, send them packing, because you know what, they're just going to go to an office down the street. Oh, and I don't know, I guess it all depends on the relationship you have with that patient.
Right. And wouldn't it be nice if it was always black and white, but it isn't. And I think I think that's why we're called practitioners, and it's a practice because we're always growing, we're always practicing, we're always learning. And I think that's one of the things that makes dentistry, healthcare interesting and fun is that it is very individualized between the patient and the clinician of what is it going to be between that. That is like your one little micro changes for the day, right?
Oh, absolutely. Absolutely. No 2 days are the same ever. No 2 hours are the same.
Well, good. So Kim, final thoughts on this. So if you had to summarize all of this into like a sentence that you would give back to the listener that reached out, what would you say?
I think I would just kind of reiterate that it's not a one size fits all, and have a discussion with your doctor and make sure you guys are on the same page. How about you?
I agree, totally agree. And you know, if I would say the same thing to a patient who has said that, you know, I don't want to do that. It's like, well, you know, get educated, talk with your clinician, and just like with any kind of healthcare, you know, find a clinician that can listen to you and wants the best for you.
Absolutely. Absolutely.
Yeah. All right, friends, thank you very much. And from Tina and Kim, we appreciate you listening. And, you know,
always
share this podcast with your friends or any of the other ones that we've had that have touched you, or you're like, that was really cool. Please share it because, you know, absolutely, we appreciate it.
We sure do.
All right. Bye, y'all.
Bye.
Thank you to our sponsor, Dental Post, the nation's largest dental job board. Be sure to check them out for different types of employment resources. Also, don't forget to like and subscribe to this podcast. And make sure you follow Tina and Kim on all the different social medias to learn other tips and tricks related to dentistry. Until next time, have a great day.